My name is Giovanni. I'm going to be the nurse practitioner today. This is Catherine. She's going to be the primary nurse on charge. This is going to be Jeff, patient number 2. Today we're going to be doing an assessment of pain and pain management. But before we start, there's 2 mandatory elements for all nursing skills. 1, check the physician's order. 2, wash hands before and after visiting with the patient and assemble your equipment. 3, identify the patient using 2 forms of identification, one with the wristband and verbally or bed tag. Introduce yourself to the client, provide privacy for the client and confidentiality. Explain the procedure and allow for questioning. Also know about your cultural differences, be sensitive to them. Standard precautions, universal precautions should be practiced at all times. Use proper body mechanics for safety on the nurse's part. Refer to the textbook and skills checklist to accompany any of the skills or steps for the skills you're performing in order to maintain safety and consideration. And if abnormal responses are noted, note the staff nurse, your instructor, and document any of the skills and the client response. Alright, so let's start out right here. With pain, there's many ways you can rate it. We have a 1 through 10 scale, 1 being no pain, 10 being the worst pain possible. There's also the Wong-Baker, the FACES chart, which are universal for people who are too young to understand the number rating scale, or for people who do not speak English. If you're going to be assessing a person that's cognitively impaired, you might want to look for other things like facial expressions, muscle movements, jerking, defending body part, vocalizations, changes in interpersonal communication, or mental changes. So, Jeff, what's your pain rating at today?
It's about an 8, I would say.
About an 8? Now, when it comes to pain, there's 2 types of pain, acute and chronic. Acute usually happens suddenly. You'll see changes in vital signs like increased heart rate, respiratory rate, perspiration, increased blood pressure. Chronic pain, usually the patient will adapt by then, so it's always important to figure out where the source of the pain came. So I'm going to ask him a few questions here. When did the pain start? When was the onset of the pain?
It happened about 3 days ago.
3 days ago? And what's the character like? What does it feel like?
It's just really dull and achy, but when you move it, it shoots.
Shoots, so when you move it, moving exacerbates the pain?
It's really sharp.
What relieves the pain?
Well, if I put some pressure on it, it seems to relieve itself.
Okay, and how long has it been going on for?
About 3 days.
You said it radiates?
Yeah, it seems to be, it shoots up my shoulder.
So right there I found out the onset, the location, the duration, where it radiates to, what relieves it, and what exacerbates it. Those are all good clues to find out your source of pain, because there are 3 different types of pain. You have your neuropathic pain, which is like a burning and sharp-like pain. You have your visceral pain, which is poorly localized, deep and cramping, more like an organ type of pain. And you have your somatic pain, which is localized, can be dull, cramping, and when you better know the source of pain, you can better treat it. So before I even go to a pharmacological intervention, I'd want to first do some non-pharmacological techniques for pain relief. Some examples of that would be hypnosis, ice packs, hot heat packs, music, positioning. But I can see on the chart that the last nurses yesterday have all tried non-pharmacological interventions, and none of them seem to work. So I see on the chart here that he has a prescription for an opioid. So I'm going to give Jeff his 2 milligrams of Dilaudid. And I'll be back in 30 minutes to reassess.
30 minutes later.
Right, Jeff just coming in because those opioids can have some bad side effects, and I want to see if the pain was actually if the pain medication was actually working. So can you tell me what your pain rating is at right now? Sounds good. Thank you. Alright, primary nurse on charge. I'm going to test you to make sure you know your pain management and pain assessment. Okay. So, what kind of drugs can you use for pain management? And what are some non-pharmacological techniques?
You can use hypnosis, you can use repositioning, you can use music.
And how long after you give a pain medicine should you come to reassess the patient's pain?